Okay, I'd like to call this Board of Health meeting to order. Roll call, please.
Crystal Alexander,
Here. Flint, Michigan.
Dr. Laura Caravala is not present yet. Brenda Clack is not present yet.
Dr. Reynolds is
Dr.
coming on.
Lawrence Reynolds,
Dr. Reynolds,
He's muted.
you're muted.
Dr. Reynolds calling from Flint, Michigan.
Okay.
Stuart Sherry,
Present.
Commissioner Shoemaker,
Present.
Commissioner Winfrey,
Here.
Commissioner Nolden.
Here, we do have a quorum. Next is the minutes from September 15th. I need a motion on it.
Move it. Support.
Been moved and supported. Do we have any corrections? Seeing none, all in favor?
Aye.
Aye.
Any opposed? Motion carries. We also have the minutes from October 20th, 2021. Can I have a motion on that?
Move it. Support.
Been moved and supported. Any discussion? Seeing none, all in favor?
Aye.
Aye.
Any opposed? Motion carries. This time is set aside for the public to comment. You'll have 2 minutes, no, 2 minutes? 2 minutes. Please state your city of residence. Public comments are now open. You step up to the mic. State your name and place of residence.
Good afternoon.
Well, before you start, actually, how we've been doing it in the past is those that would like to speak would go and stand over here.
Here?
Yeah, and then they go, but you're here now. No, they would stand, they would stand over against the wall there, and then they would come up to speak. So I just
Okay.
want to make sure so we don't have any issues with anyone.
Okay.
Okay, now
I
go
follow
ahead.
direction very well.
Yeah, I know you do, Bob. Thank you.
Bobby Walton, I live in Davidson Township. I usually come before you to tell you something you already know. I just remind you. The current announcement by the Director of Public Health, our Public Health Officer, that she will be removing the mask mandates for children above 5 years old has caused a little bit of consternation in the population of those of us who care about what happens in our schools and what happens with the safety of our children. And I guess the biggest question I would have for the doctor is, what now? Because we know from what we get from CDC and other scientifically based information sources that masking children as well as adults in closed environments where we are put together in a crush, whether we're vaccinated or not, is an additional protection from catching COVID. And COVID can harm people even if they recover from it, they can have impacts from it. What I want to call to your attention is the fact that school boards are terribly subject to political pressure because the people on school boards are elected officials. And the two of you on this board are probably the only ones subject to election, but there are others who are not necessarily because they're appointed. School boards, because they're subject to pressure from the political world, are less likely to do the right thing to protect the safety of children. And that's why I'm asking Dr. Hackert to reconsider her order and to see what can be done to protect the children besides putting it in the hands of a school board, which is a politically elected body that is subject to political pressure. Thank you.
All right, thank you very much.
Brenda Heno, Vienna Township. Nuremberg Code. Simple search online, you can find multiple forms of it, whether it's in an article or this one is the British Medical Journal, volume 7070. I'm only going to read a portion of the 10 points. The first one, beginning of it, is a voluntary consent of human subject is absolutely essential. This means that the person involved should have a legal capacity to give consent, should be so situated to be able to exercise a free power of choice without the intervention of any element of force, fraud, deceit, duress, overreaching, or other ulterior form of constraint or coercion, and should have sufficient knowledge and comprehension of the elements of the subject matter involved as to enable him to make an understanding and enlightenment decision. The experiment should be so conducted to avoid all unnecessarily physical and mental suffering and injury. The degree of the risk can be taken or to be taken should never exceed that determined by the humanitarian importance of the problem to be solved by the experiment. During the course of the experiment, the scientists in charge should be prepared to terminate the experiment at any stage and has probable cause to believe in the exercise of good faith, superior skill, careful judgment required of him, and that the continuation of the
10 seconds.
Yep. And that if it's to result in injury, disability, or death, the experiment should be ended. The FDA never gave us the full knowledge of the mask shield or vaccinations.
Thank you for your comments.
Thank you.
Thank you.
Hello, my name is Ashley Prue from Fenton. I want to start by thanking the Health Department for the work you have done to keep our children safe. We know that this has been a very difficult time. Genesee County Parents for Safe and In-Person School is concerned about what is next for the safety of the children of the county. We understand that vaccines are available for 5+, and I was very thankful to have my son vaccinated with his first dose last week. But our concerns are not only for our children, but for unvaccinated children. Minors have no choice in the matter, and removing the mask mandate without requiring vaccinations in schools will put unvaccinated children at higher risk of serious illness, hospitalization, and death. Parental autonomy does not give parents the right to put children in high-risk situations. There are many laws indicating as much. Parents cannot drive their children anywhere without a seatbelt. They cannot smoke in cars, and they can't, without an exception, even send their children to school unvaccinated. Requiring children to wear a mask or even to get vaccinated to attend school is not a violation of anyone's parental autonomy. Our group understands that one of the primary functions of government is to protect the most vulnerable. In this instance, that means children of parents that fail to vaccinate them in the face of a deadly virus that kills, and even when it doesn't, can leave long-lasting medical problems for those who survive. Our goal is to keep schools safe and open for all children, not just our own. It is very likely that without a mask mandate or a vaccination requirement, that many children will get sick and schools will close. But we also know that our schools will not continue to require masks without the mandate because the school boards will be bullied. So our question of what we do now and how we keep our children safe is weighing heavily on our minds. So we simply ask, if the mandate will be lifted without ties to vaccination or transmission rates, what is the next step the health department intends to take to protect children that are unvaccinated but are required by law to attend school?
Thank you for your comments. I'm going to ask this one time only. When people are speaking, I would prefer for people not to comment out in the audience. Everybody has an opportunity to speak. If you're going to speak out in the audience, I'm going to ask you to leave. Thank you.
Thank you.
My mom. Your name? My name is Kinsley Shaw from Genesee Township. My mom got fired because, hold on, she said heck no to the corona shots because the COVID shots are bad for you.
Thank you.
Good morning, Carolyn Ants from Fenton Township. Disappointed in empty seats today. Last month during the meeting, we received a COVID update from Dr. Hackert, which consisted of data regarding cases, nothing about sickness, how many went to doctors, how many went to the hospital, nothing like that. And then an embarrassing demonstration on how to apply a mask, how to teach a child to adjust their mask. I mean, how embarrassing. Something about an example in a California school. I mean, ridiculous. Hopefully, we can talk about actual children that are sick if that's the topic. And of course, we're going to have cases because they test constantly. They test everything for a sniffle. And we know the PCR tests aren't accurate. Also, only a couple commissioners even had a question last time. And then you even said, another question? Guess what? They have as many questions as they want. And you guys should give as much time to this as possible. And there shouldn't be empty seats. How can you form a decision if you don't ask questions? Really? This is about 700 deaths. Not 700 deaths last month, 700 deaths total. 2 in Michigan, 0 in Genesee that this masking is, and now this vaccine. Next month, let's give data on how many children are dying from the vaccine. Let's keep track of the death rates now of children
10
from
seconds.
previous years to now that they're getting the vaccine. And I guess I'm done, not really, but
Thank you for your comments.
thank you.
Good afternoon. My name is Chris Bosinski. I live in Davidson Township. According to your data, by that I mean Genesee County data, as of November 5th, the highest percentage of recent cases in children between 0 and 17 years is over 20%. This age range is 16% of overall cases since the pandemic started. Depending on which source is used, your site or Michigan's Safe Start, Genesee County's positivity rate is between 13 and 17%. This is far too much community spread to remove mask use in the closed environment of school classrooms. Your decision appears to be made to remove masking based on the availability of vaccines. Vaccines have been available for over a year, yet only 47.8% of eligible population 12 years and over are vaccinated. Vaccines for 12 to 15-year-olds have been available since May. Only 30% have completed both doses in the county. For 16 to 19-year-olds, it's only 39% fully vaccinated. That is not enough to remove masks in school. We assume that these same percentages will continue for kids 5 and over. The whole state is only 70% vaccinated. The whole state is colored red. Transmission rates are far too high. Neither the State of Michigan Department of Health nor the CDC has changed their mask usage guidelines for schools or indoor places. The mask announcement is premature and isn't backed up by any numbers readily available and will put lives and physical health at risk. Thank you.
Thank you.
Hello, my name's Evelyn Cordova, 5297 North State Road, Davidson. I am a preschool assistant teacher for the Davidson School District. So the 3 and 4-year-olds, and as well as I, will all be continually masked up. I want to give you an example of some of the things I deal with on a day-to-day basis. This is the time of the year that there's runny noses. This happens, we expect it. The sad thing is the 3 and 4-year-olds, they're pliable, they trust us, okay? And we are teaching them to keep their germs to themselves, which is in their mask. So they're constantly coughing, blowing their noses, picking their mask up, putting it back down. 3-year-olds are compassionate. They want to help out the other kids. They pick up the other kid's mask, okay? I'm seeing germs, bacteria spreading, okay? I'll give you an example. One little kid that's very shy, I notice he's a little shy and quiet in the corner. He's got his mask on. You know, the kids, we're supposed to educate them. We're educating them to be fearful. I confront him to see what's going on. His face under his mask is full of blood. You know, there's bloody noses. He was too scared to pull the mask off. I deal with that. That's what I see. They have their fine motor skills. They lack them. They're trying to learn them. And so I have to constantly, as well, the other teachers have to constantly adjust their mask, help them, put them back on, and we wouldn't be touching their faces that much. It's awful to see these little 3 and 4-year-olds. I speak on behalf of every parent and every teacher and every child that doesn't have that choice. I was quarantined. The teacher that was vaccinated was not. We both can give and receive COVID as well as the other kids, okay? A lot of parents, so you have one parent or one child that has positive, okay? He goes home. All the other kids around him has to be quarantined. There's job losses. They're struggling trying to find babysitters. Let's just use wisdom, guys.
Thank you.
Come on, these are
Thank
children.
you. Thank you for your comments.
Hi, Susan Hendricks, Grand Blanc. First, thanks for all your hard work. This is a difficult time, and it's imperative that we do everything we can to keep our citizens safe. I just want to point out that I think the loss of the mandate is premature. Michigan is now the highest COVID rate in the nation, with the state reporting over 21,000 new cases on Monday, or an average of 7,000 for the past 3 days. This is not safe. And the holidays are coming up, and children will be traveling, people will be traveling. They will be intermingled with a variety of vaccination rates, a variety of age issues. And then they'll be coming back to school and bringing all those things with them. And our kids will not be masked, they will be a lot more susceptible. This not only is dangerous for our children, but it disrupts the education that we all have agreed is absolutely essential for them to be in person. It also, I hate to say, keeps women out of the workforce because they can't take jobs if they're constantly having their kids quarantined. There is no childcare that is going to be on and off and on and off for this sort of thing. So it's absolutely essential that we keep our mask mandate because the numbers are not showing us that we are ready to have that. I would love to be mask-free, but I also know that that's not where we are yet. Our numbers are proving that, and they're going up. And we have to make sure that people are safe. And like I said, holidays are coming up. We want our kids in school, and we want our kids safe and healthy without permanent issues because that's going to be an issue. I'd also like you to consider a vaccine mandate, just as what we have mandates for everything I had as a kid. And, but my sister did not have to have, and, she's just healthier because of it. I just want to make sure that we realize that we have a whole list of things we already do. We need to add this to this for our children's sake and, frankly, for the rest of us in the
10
community.
seconds.
So, because remember, whatever happens to our kids will then spread out into the community, and the rest of us rely on you, those of us with pre-existing conditions, to
Thank you
keep
for your
us safe
comments.
as well. Thank you.
Hi, Tara Phillips, Linden, Michigan. I want to know why Dr. Pamela Hacker took off her mask when she spoke during the press conference held on November 15th. Has COVID once again become that smart that it can't be spread while you're the speaker? Do our teachers throughout the districts have the same privileges to take off their mask when they're in front or teaching our children? It's kind of like a press conference, isn't it? Do our students have the same privileges when they are talking to anyone? Do all the board members wear a mask all the time, or is it just for the press conference? Again, why is Dr. Pamela Hacker's mask off? Is it because it's hard to hear and understand people with the mask on? Ms. Hacker, you wore a mask during the last health department meeting, and your presence was through a computer. Your presence should be made here at these meetings so we can address you personally. I'm sure most people will take this press release as a win. I see this as another month and 5 days with masks on our children. Hacker said the only exception would be if there is a variant that we don't have any knowledge of, nor arising that these vaccines will not work against. What will the narrative read come 2022? A flu outbreak like no one has ever seen in history? So keep your mask on and get the flu shot, because as of 12/31/21, new tests will be used. But until then, our numbers will continue to be inflated. Will it read a new deadly variant caused by the unvaccinated, or the Delta variant is spreading at a rapid pace because of the unvaccinated? Let's look at the CDC site, which states if you are fully vaccinated and
seconds.
become infected with the Delta variant, you can spread the virus to others. So why is anyone up here pushing the narrative to get these vaccines? Our toolkits are creating spreaders. As I said before, the more things like this happen, the stronger and bigger we the people come.
Hi, Michelle Ryder, Grand Blanc Township. I didn't have anything prepared today, but I didn't really know how to feel when the mask mandate being lifted first was announced. Because this whole time I have been saying, I just want to get my kids vaccinated, and then based on what Dr. Hackert said, it was going to be a vaccine availability as well as a numbers, and then the decision would be made. So I would respectfully ask where the science is on this decision, since yesterday was Michigan's highest day ever since COVID has been here. The Delta variant has been known to be contagious through vaccinated individuals as well. And also, I would ask this board to make Zoom comments available for parents who are not able to come to these meetings or willing because of said rising numbers. At least from now until the date that it's supposed to be lifted, I think it's only fair. I know 10 people right now that would be here if schedules allowed and COVID numbers weren't so high. So, thank you.
Thank you.
Hello, Alicia Hensley, Davidson, Michigan. So my notes are a little bit all over the place and kind of switched gears here. I definitely am happy that my children will go back to school, the kids will go back to school after Christmas, and I do appreciate the mask mandate being lifted. I do agree that that's another 30 whatever days with masks, which I'm not happy about, and especially the littles, specifically the least risk of all children having COVID are the ones that are still wearing masks. So I will still continue to send my emails and I'll still continue to advocate on their behalf. That being said, I've listened to everybody today talking about how we've had the highest COVID numbers, and that is not debatable. I'm not debating that. We absolutely are at a high. But I will say when the mandate was put into place, there was 8% with 101 cases per 1,000. When it was extended to all the children, it was 11.2% with 184 per 1,000. And now it's 21.4 with 479 per 100,000. So that to me, all that tells me is that we don't need to keep the mask mandate. The mask mandate doesn't work. And that's what we've been saying all along. Mask efficacy, I've sent you the numbers. We can compare counties. We had a good time doing that on email last week. We can compare counties, and looking at Lapeer County, same exact positivity rate as us. They've never been masked. So all these high numbers tell me is that we're testing. It is cold and flu season. This happens. It spreads. And I guess I'm just listening to everybody going, we need to keep the mask mandate. Well, no, the mask mandate hasn't worked. It's been in place for 97 days. And we're at an all-time high. So I did reverse my thinking a little bit because I'm listening to this and I'm just like, get the mask mandate back in place. But it doesn't work. That's all it's proved. And that is science. Like the numbers have proved that it hasn't worked in 97 days.
Thank you.
Thank you for the opportunity to speak. My name is Tim Drager. I live on Lindbergh Court in Fenton Township, Michigan, Linden address. As the husband of a Flint area middle school teacher whose school is currently seeing spikes in COVID-19 among both the students and the teachers, I am very concerned about the lifting of mask mandates. My wife is fully vaccinated, but a handful of the teachers, most of the student population in her school, remain unvaccinated. The inability of teachers to fully protect their students by getting vaccinated, or by parents who deny basic public health data to vaccinate their children, put the rest of the school population, both students and staff, at risk. Unfortunately, the collateral damage is what many people are going to experience. That's the risk. I, for one, will not be visiting my 78-year-old mother or her 92-year-old sister this holiday season because of the ongoing outbreak of COVID in my wife's school amongst especially the unvaccinated. My kids go to MSU. Dr. Samuel Stanley, the president of Michigan State University, an epidemiologist, has made it clear students will continue to wear masks in classroom buildings through the remainder of the academic year. Dr. Hacker, I know your staff has been pummeled throughout this pandemic. Please know that I and many others, like me, appreciate your efforts at keeping our students and the teachers, like my wife and her fellow teachers, that give all to both teach and protect them safe. But please make sure that we continue to follow science, make choices based on the best medical practice, and not be overwhelmed by the loud voices of people that care for no one else's freedom but their own.
Thank you.
Good afternoon, Board of Health. Debbie Zofko, Vienna Township. A lot to cover here. I second everything that Alicia Hensley said. It should be very obvious and apparent to people that every intervention that the state of Michigan has instituted has been a failure, because if they worked, our cases would be down, right? Okay. The vaccinated also spread the illness. 60 Minutes, CBS News, March 8th, 2020. There's no reason to be walking around with a mask when you're in the middle of an outbreak. Wearing a mask might make people feel a little better, and it might even block a droplet, but it's not providing the perfect protection that people think that it is. Your World Cavuto, July 23rd, maybe 2020. You do not need to wear a mask indoors if, in fact, you've been vaccinated. Good that you're vaccinated, but in a situation where you have people indoors, particularly crowded, you should wear a mask. C-SPAN, August 19th, 2020. You don't want to mandate and try to enforce anyone to take a vaccine. We've never done that. We don't want to be mandating from the federal government to the general population. It would be unenforceable and not appropriate. NBC Nightly News, September 9th, 2020. There are a number of people, for one reason or other, who just do not want to comply and get vaccinated. We've got to get them vaccinated, and hopefully they will do it willingly. If not, it will have to be things that essentially put pressure on them. Do you guys know who said those things? Those are all quotes. Fauci. Those are all from Fauci. One time it's this, one time it's something else. The people just need to be free. We're not promised an infection-free life anywhere, not in the Constitution and not in the Bible. Viruses spread. That's what viruses do. Viruses spread. True herd immunity is when it spreads through the whole population naturally. Thank you.
April Snyder, Grand Blanc. So when Dr. Hacker announced the mask mandate in August, that took away students' choice to have a mask. It said everybody had, or to not wear a mask, everybody had to have one. So unlike this announcement the other day, people who choose to wear a mask can still wear one. You are not being told not to wear one. The students and the teachers that want to wear one can continue to wear one, but it gives back the freedom to the students and the families that don't. And as far as I'm concerned, it's great it's coming off December 22nd, but it should have been off October 1st. I don't understand why there's this big issue of not understanding the legality of the budget, not allowing for the health, to declare the health rules or whatever. It's a law. OSHA can understand that. As of today, OSHA has since announced that it has suspended activities related to the implementation and enforcement of the ETS pending future developments in the litigation. They saw that it was now illegal for them to do this based on what the court ruled. They followed it until this gets finalized. That's what should have been done when the state budget was passed on October 1st. That mandate should have been lifted then until litigation or whatever needs to happen gets it figured out. So
I guess thanks for dropping it, but it should have been done already. The only other thing is the quarantines with kids in school. That needs to be addressed. There needs to be clarification. I'm assuming those quarantines should go away as well. If they want to continue to offer the antigen testing for students that are masked, fine. Give the parents a chance to opt out. Let them sign a form saying, I'm acknowledging my child will not be masked, and I'm acknowledging that they will not be eligible for antigen testing and will be quarantined if that's what you have to, but you have to keep these masks off of these kids.
Hello, Lindsay Spiwak, Davidson, Michigan. So I'm actually going to quote some quotes from Dr. Reynolds from the last Board of Health meeting. I've heard a lot of things over the course of the last several months, things that have really bothered me and kept me up at night, and some of those things just came from Dr. Reynolds from the last meeting. Let me quote some of the things he said. Dr. Reynolds said, "To reach herd immunity, people must suffer and die. And the purpose of vaccination is to reduce that suffering and death rate. No vaccine is 100% effective. It's never just about me. It's never just about you. This is called the Board of Public Health, not the Board of Freedom." I'm here to say it is about freedom. I stand here in honor of freedom, asking for freedom, especially when the health director is taking away our freedom. I'm not denying that people are suffering and dying every day from COVID. But people are also suffering and dying from the vaccine. I have a girlfriend whose 20-year-old son had to take the vaccine for a job. Otherwise, he'd lose it, would not be able to put food on his table. That 20-year-old son is now suffering from myocarditis. I have a girlfriend who I went down to visit down in Florida, whose mom passed away days after receiving the vaccine. We are asking for the freedom to choose between natural immunity or the vaccine, especially since you can still get COVID after the vaccination and still spread it. We are also asking for the freedom to choose to mask up or not, as 2 of my children have been harmed by this mask. An Oakland County bus driver came to the commissioners' meeting and he talked about the shame that he sees on these kids' faces when they get on the bus and they realize they don't have a mask, grabbing their hair to cover their face. We are ruining our kids, you guys. It's very sad. I know I've asked you guys to go into the schools. Have you guys gone into the schools to see what's going on?
10 seconds.
We're not standing here trying to bully you guys. We want you guys to have the freedom to wear a mask if that's what you so choose. And we're not bullying the school boards either. We're just simply asking for freedom. Thank you, Commissioner Nolden.
Holger Spiwak, Davidson, Michigan. I'm going to use my time to play a testimony from a doctor from Trinidad and Tobago about his findings looking at blood of vaccinated people under the microscope.
I'm probably the only practitioner in Trinidad and Tobago that put up the blood of a vaccinated person under a microscope and see exactly what them seeing. Rulo. Clumping up of the blood cell. And just as she is amazed, and she mentioned that she have never seen nothing like that in her entire career, and she's worried about her patients, so am I. And I was telling you guys that I have never seen nothing. She just see Rulo. The things that I am seeing here is a little more advanced than just the Rulo. I am seeing massive levels of candida in the blood, fungus in the blood. And the white blood cells are just standing there and ain't doing anything. Actually, you're barely seeing white blood cells. I have never seen that under a microscope in my entire career. And I continue to see it on the vaccinated persons. But the one I posted recently was the worst I ever seen under a microscope. I've never seen that. The last patient I saw that was in 2015. It was an AIDS patient. And she was dying from HIV and not responding to treatment. And the reason why she was dying from HIV because her immune system was completely compromised. And all the bacteria and fungus and all these pathogens just eating out her cells. And I saw that.
Thank you.
Thank you for your time.
Catherine Keller, Burton, Michigan. So there are other reporting sites if you don't trust VAERS. The World Health Organization has a reporting site for adverse reactions to the COVID-19 vaccine. And as of now, on Vigi Access, so anybody can go look this up, World Health Organization, I repeat, has showed 2,528,564 adverse serious reactions. Serious reactions. People are paralyzed, they're dying, they're blood clotting. I mean, this is bad, you guys. And you want to mandate this on my child. And by the way, people keep saying, you have to get vaccinated to go to school. That's not true. I have a vaccine-injured child who has 3 different types of seizures from a DTaP that she received when she was 11 years old. Okay? She's now 21. I got a waiver with no problem. I didn't have to prove anything. I just went in, said I do not want to have the rest of my children vaccinated, and guess what? I handed it into the school and I haven't had a problem since. So you can go to school. My children have been going to school successfully without vaccines. So to say that, oh, we have these mandates for others, no, we don't. There are exemptions, and you don't have to prove anything. You don't even have to prove religion reasons. So that's BS. And I'm not getting my children vaccinated. And I'm sorry if that makes you scared for your child, but so far I haven't seen any of my children cause harm to anybody because they're unvaccinated. And that's my decision. And guess what? They're seizure free, and they also didn't come down with some serious illness they're dying of because of their non-vaccination. So that's just a bunch of crap. Stay in your lane, worry about your children. If you don't like it, then keep your kid home. You have the option too. Isn't that what you told us? Keep our kids home if you don't like it.
Time.
Hello, everyone. It's Michelle Grozier from Swartz Creek. I had submitted from the NIH some studies, a very lengthy study, 52 pages, to all of the Board of Commissioners. I failed to send it to the Board of Health, and I should likely do that in the next couple of days. That proves the dangers of all-day masking. This is a 52 to 54 page study that has pulled together numerous other studies indicating the dangers of all-day masking. It's one thing when you walk out of your house and you have to wear it for an hour. These kids are masked 5 days a week. And I know it's already been highlighted, but if these case numbers are up, what is masking actually doing? It's creating a lot of division, the fear-mongering, and the what it portrays. It's just not healthy. You guys already know the story of my daughter. She was on the edge of suicide. The division that she experienced among her peers and the threats you pretty much receive in the communication at that age when you are not on board with, the mask, it's clear it's not doing all we had hoped it would. These kids need choice. Families need choice. We just need to stop all of the, it's just creating too much division. I appreciate that Dr. Hackert is taking the mask off of our children. Yes, I wish she would have done it much sooner. But I want to thank her for doing that. I hope she continues on that same path and doesn't change her mind. And I appreciate all you are doing.
Comments.
Thank you.
Public comments twice. Public comments 3 times. Public comments are now closed. Next, we have Health Department bills, October 2021.
Pay the bills.
Support. Been moved and supported. Any discussion?
I have a question.
Yes, go ahead.
I have a question. I noticed in the last month's bills, we have a $49,510 payment to something called Mattel Call Recording Solutions. I was wondering if someone could explain what that is.
That is for audio recording for the main lines of the health department.
Is that new?
Yes, it is.
I don't recall us reviewing any bids like we normally do for this.
Mitel is the county vendor for our phone lines.
So it wouldn't come to us.
Do we use that in all county departments?
Yes.
Seems like a lot of money, $50,000 a month to record. I mean, I don't know. That's why I'm curious why we haven't
Not
explored other options.
$50,000 a month. It was a one-time fee for installation and for our yearly charges. So yearly, it'll be, I believe, around $2,000.
Okay.
Anything else? All right, thank you very much. So we have, it's been moved and supported to pay the bills. All in favor?
Aye.
Any opposed? Motion carries. Next, these are positions that need to be refilled, and if you don't mind, could we move them all at once?
I'll make a motion to move 1 through 13.
Support.
Okay, it's been moved and supported to move 1 through 15. Do we have any discussion on this?
Is it 13 or?
13, I'm sorry.
No, I just wanted to
One
make sure
through
we
13.
didn't add extra 2
I'm
somewhere in
sorry,
there.
1 through 13. Do we have any discussion on it?
I just wanted to add that,
Brenda?
okay, all right. That I would like us to maybe look into a future study of wages, because it's a lot to have to hire at once. And on some of them, when I looked at the wages, I think we're a little off, and I don't think we're going to attract the best candidates for this. So I don't know if it would be up to us at the health board level or us at the county board level, but I think we need to definitely look into this.
I think that's a conversation that needs to take place between Human Resources and the Health Department. And then they can actually bring the wage study back to us for us to look over it. But that's something that I know we've been looking at throughout the county. And I do know that we talked about G-Card, we talked about the park board, and definitely we need to look at the health department as well.
Exactly, thank you.
Okay.
It seems like there's 20 positions that say refill. Is that because people have left?
Yes,
Voluntarily or involuntarily?
voluntarily.
So we've had 20 people resign in the past month from the health department?
That's correct.
That seems extraordinarily excessive.
Most people cited one of their main reasons was they would like more flexible work options such as work from home. Others have been for higher salaries, and then others have been for promotions with other organizations that would not have been available at the county.
How many people work in the health department?
About 150.
I guess I'm agreeing with Sean, like, that really seems a little bit, I don't know, scary for the community that we have 20 people resign in a month. I mean, are we able to support the other programs right now, or is there things that are suffering?
Most of them are COVID positions
Okay.
that people have left because they are based on federal COVID funding. Once that funding ends, those positions will be over. So there is significant motivation for those individuals to either find jobs that are located in other county departments, such as the sheriff's office, the controller's office, or going to other organizations that can offer them permanent employment.
When's the federal funding end?
The federal funding that we have available to us right now is for the 21-22 fiscal year, which ends September 30th, 2022.
Okay, so almost a year from now.
Correct.
Okay, thank you.
All right, any more discussion? Seeing none, all in favor?
Aye.
Any opposed? Motion carries. We're moving on down to contracts, a cumulus contract, A and B. I think B is the actual contract itself and A is the resolution. So I need a motion on that.
So moved.
Support.
Been moved and supported. Any discussion on the cumulus contract? Seeing none, all in favor?
Aye.
Any opposed? Motion carries. Next is the 2022 meeting schedule approval. Meetings will be held on the third Wednesday of the month at 1:30. We have the dates there below. So I need a motion on that.
Support.
Been moved and supported for the meeting dates. Any discussion?
Yes. So I appreciate a few months ago, Dr. Caravella mentioned that we all should understand the rules and regulations under which we operate, whatever board we serve on. And I requested the Board of Health bylaws. It was sent out hopefully everyone read it. But Article 5, Section 1A says the time and place of regularly scheduled meetings shall, and as I've been told by my friends in the audience, shall is a strong word in the language, legal law, shall be determined at the first annual meeting in January each year. So my question would be, why are we deciding today? If that is a violation of our bylaws.
I asked them to put them there so that we'll have a general idea of what days and what months that we meet. So I just thought that we can do it early so that we would just have it so that everybody can have their schedule ready at the beginning of the year. But
And
if you want to wait until the first meeting in January, which we still got to set, we're still going to have to set January 19th as the first meeting.
So Commissioner Nolan, I fully appreciate your answer, and I think that you've been very open with me. And I don't disagree with making that decision today. The frustration I have, and it's a bit, maybe what we'll discuss later, is there's just inconsistent following of our bylaws. If we're going to decide today, which I'm not against, I would like to suggest that we don't meet at 1:30 in the afternoon, because that, as we've heard from everybody, I think that's ever attended these Board of Health meetings, is a very difficult time to attend. It's the middle of the workday. So I would propose that we do something either first thing in the morning so people can maybe go into work late, or we do it in the evening.
I know it won't work in the mornings because those are Board of Commissioners meetings. So I know that won't work. Commissioner Shoemaker.
I think the simpler, well, with this problem that we're dealing with right now, which is the bylaws state something, what we have to do to change the actual bylaws, just to state we can approve the meeting minutes, a month before, or, up to 2 months before the,
No,
January.
let's do this. Let's go ahead and drop it. And then in the meeting in December, we'll schedule a meeting for January. And then in January, we'll accept the meeting dates.
I just think it's easier if we, maybe you and I talk about it late, as far as,
No,
I'm,
there's no problem.
just so because I think it makes more sense to schedule them out a little farther in advance. And it always amazes me that January 1st, you're supposed to schedule them, but yet you don't know when you're scheduling a meeting.
Absolutely.
And we have that with the county board also, and that's something maybe we should, we could look into, so.
All right, so we'll drop that. We'll drop this right now. So we're going to move down to communications. Under communications is the reported communicable diseases for October 2021.
Hi,
It
this
is
is Danielle.
attached.
I'll take that part. So for communicable diseases for October 2021, we don't have a lot new that's worthy of mentioning. I will note that in September, we did see a small increase in salmonellosis cases. Several of those cases were linked to onions that ended up being recalled. We did not see that trend continue in October, so that's good news. In terms of other things to note, we have had a few of our hospitals report to us that they are concerned because they are at or near capacity, and they have expressed to us concern that they would like help in education and communications to the public about emergencies and coming to the hospital, and if it's not an emergency, visiting a primary care provider or an urgent care, and so expressing that kind of communications.
Okay.
And that's all I have in terms of the CD report.
Okay, do we have any questions for Danielle? Seeing none under.
I do.
Oh, go ahead, Commissioner.
So I think that's a very interesting point about the hospitals. And we also just talked about a advertising campaign we're doing that we approved money for. Other than just saying it in this meeting, we need to do something. Can we utilize some of those air spots to explain to people the difference between urgent care and emergency room? Or what would be the recommendation to actually do something?
I think that's part of the conversation as they do the radio spots, is to get this information out as they receive it from the hospitals. We just received that information, was it last night or this morning? So this is something that I know will be out on the webpage probably later on today.
Yep, and we've done media interviews regarding it already.
Okay, and some interviews have been done, so that is a great point. I do appreciate it. Commissioner Shoemaker?
I was just wondering if we could spend some art money on advertising also to try to alleviate if we qualify.
This cumulus contract is some art money.
Yeah, so because this is, the surge, according to the hospitals, is COVID related, this would fall under COVID relief funds that we could use for advertising to assist the hospitals with their messaging about what is an emergency room type of event and what is a primary care physician or urgent care type of event.
Did they send a letter or was it a contact call?
It was on a community call this morning with the governor's office, the one with Gary Jones and Eli, I forget his last name.
Did they allude anything to the fact that they are short-staffed and that's why they're at capacity?
They mentioned bed staffing is one of the issues, but they didn't really go into detail. Their more concern with us was the ask about getting the information about
ER.
please don't come to the ERs for non-emergencies.
All right, thank you.
Okay. We'll have nothing else for Danielle. We're going to move on down to other business. Health Commissioner Sherry, I didn't know if you wanted, it's supposed to be private communication. You got that response. Are you okay with that? Okay. So at this time, it's just, do we have any other questions or concerns?
I just had a few from some constituents that had some questions, and I don't know if Kaylee could answer them or Dr. Hackert, if it would be okay with the chair.
Go ahead.
A lot of our superintendents are questioning as far as the quarantining. Will it stay the same as far as when the masks are removed? What will go on? What's the process after that? Do we?
In terms of the school toolkit?
It's for, yep.
Yeah, that's something that we're working on right now, and we will put out the updated school toolkit to be effective on the 22nd with the rescission of the mask mandate on December 1st.
Okay.
And we do anticipate, Dr. Hackert, I'm homesick. We do anticipate having two school toolkits. One will be for schools that have universal masking still in place, and one will be without that, because some of the things that we've been able to implement, such as test out for people in quarantine due to school contacts, we would not be able, that is dependent on having masking. That's a directive from the state. And so we would have two separate ones, and we would allow schools to absolutely encourage them to change their masking requirements, and both would be available, but the actual isolation quarantine process will be different between the two.
Okay, go ahead.
To continue on that line of questioning, is that going to be out far enough in advance that the schools can actually prepare a plan? Because some of the complaints I'm getting are, it's the news media, you're in front of a camera, and then the school has to react to it, and they're not prepared, so.
As I
Can we
said
make sure we
previously,
do
it's
that?
going to be out December 1st, and the mask mandate ends on December 22nd. So it'll
Okay,
be out 3
super.
weeks in advance.
Thank you. And then this is a question, and as far as we know, as far as testing though, and the test provided by the actual schools, have we given any guidance on that or any help with how they should be doing that at all? Or is it just for them to hire, like at our school district, they've actually hired a couple nurses, but the kids are actually still doing the swabs, which makes me question. I mean, not that my child who's had to do it does it wrong or right, but they are kids. So I was just wondering if we provide any guidance to that or additional help.
We do have additional funding that's coming in, and we are trying right now to hire people who can come in for 2 to 3 hours each morning to do testing, and then someone to kind of oversee each district's testing that would help facilitate that.
Okay, so that's pretty much what I had. Is it going to be any cost to the school then, as far as the testing kits or the personnel?
So the testing kits are available. GISD is able to order those through a state program for school testing. So those are provided, I believe I don't think it's federal, I think the state pays for them, but those are provided to the schools for free. And the funding that we've been provided to help with the testing is a federal grant. So if we need additional people, the schools might have to hire additional people, but I believe it was 1.6 million we were awarded to do that. So we're hopeful that we can find enough people and use up that money so that the schools have to fund as little as possible themselves.
Thank you so much.
And also, just for information for you, currently the state is giving out 500,000 tests to the schools. I believe it's per week.
Okay. Commissioner Sherry?
Yeah, I have a few points. First of all, just a thank you to Dr. Hackert for what I would consider a more balanced approach to masking in schools. I think back when myself and Kaylee and Dr. Hackert were on more friendly terms, I would say, where we'd communicate more openly, I think you shared with me that it was your intention to have a balanced approach, and I think that's more where we're heading, so I do appreciate that. I also acknowledge your difficult position, as I've said before, that you will never make everyone happy, and do not envy you to be in a role like you're in, where no matter what decision you probably make, there's gonna be a group of people angry with you, so I give you credit for that. With that, I did have a question, if you could maybe elaborate. I did watch the press conference, but I think, news that was covered on NBC 25, their feed didn't work very well, so I couldn't hear everything. Besides what was the big reason to make the change from the original order, where it was vaccine plus 6 weeks, to caseload, and then back to vaccine plus 6 weeks?
Sure, I can go into that. I am actually in the process of writing another directive. And so if you recall back on August 3rd, I wrote the first directive in the state to strongly urge all schools to put in mask mandates, and gave quite a bit of evidence that there was reasons to do that. And at that time, I was trying very hard to get that in while we were still in the moderate category, so as not to look like we were being reactive. We wanted to be proactive with this idea of mask mandates issued by the school districts to take care of the children, particularly under 12 years old, who did not have vaccines available. And in that directive, excuse me, I had actually said the directive will continue until Genesee County Health Department confirms that the COVID-19 risk to the county residents is substantially reduced based on one or more of the following. And then I listed 3 different items. COVID disease rates are declining and stabilized to low or moderate community transmission for at least 2 weeks in a row, as defined by the CDC and per the Michigan Safe Start Risk Map. Clearly, we have not met that. COVID-19 hospitalization and death rates stabilized at low or moderate levels. Clearly, we have not met that. However, said, or a safe and effective COVID-19 vaccine is authorized by the U.S. Food and Drug Administration for use in children 5 through 11 years. And by August 11th, I realized that that directive, which was very strongly worded, was used by most school districts in the county as authorization to require no masks at all, regardless of any kind of disease transmission. And so because there is still no vaccine available at that time, on August 12th, I put in the mask mandate as a health order from the health department. And that is the role of local public health sorry about the loss of voice. That's the role of local public health, is to be a stopgap measure to protect the most vulnerable when there's no other means to do it or no one else has stepped up to do it. And so in each of these, I have been very consistent. And on August 12th, I again stated that this was for the protection of children under age 12. Then on September 10th, I believe it was, when I added the pre-K through grade 12, much of that was because it was clear to me that there were significant episodes happening in the schools, some of the private schools that were smaller, or some of those school events that happened where children who were under 12, who did not have that opportunity to get vaccinated, were mingling with children in older grades. And so that's why I took out the portion that was just solely based on vaccine availability. And this is why, now that we have had the vaccine available for children between ages 5 to 12, that I wanted to be able to put it back on the locally elected Board of Health to implement mask mandates for their communities. And I am going to put out another directive, again, stating that the CDC and the HHS, the AAP, and the Genesee County Health Department still strongly recommends not only masking in schools, but when this level of transmission is so high, every single entity that welcomes visitors to, like public visitors to their premises, should have a mask mandate in place. It is actually critical to do that. But that is not the role of the county local health department, in my opinion, to do that, because it's too easy just to go across the border to spend your economic dollars. And so it's something that can be implemented by the state as they did last year, or it's something that can be implemented again to protect the children in transmission settings where they are required to be in school for 7 hours a day. Almost any other occupation, well, not any occupation, but any other situation where children in particular are required to be in a setting is not that long, or it's optional. So they really have, schools have an obligation to children to try and protect them. But the parents also now have the ability to protect their children with a vaccine that is over 90% effective, and it is available freely within our community.
You have another question?
Yeah, so thank you for that explanation. And again, I just give you a lot of credit for being in a tough position. Maybe a simple question, and this might be to Kaylee. Since we had kind of a strange meeting last month and it wasn't a normal meeting, can you send out the September bills? Because normally we would get those every month, and I noticed we did not, or maybe to Commissioner Nolden. The other thing I wanted to bring up is and if you haven't noticed, I am a bit of a stickler to the rules and regulations. So the other thing I've noticed in the bylaws is Article 4, Section 2E says the Board of Health shall review annually with the health officer the performance of the health officer, the department's programs, and its staff. Has that ever happened before? And if not, how do we go about doing that to comply with those rules?
We haven't.
Okay. I guess I would say I think would be a good idea that we do. And I don't know if we discuss it offline, but I think we need to find a format and a method how that takes place. And I would imagine it has to be an open meeting if there's a quorum of the members, so.
Absolutely.
Do I need to make a motion to consider how to move that forward?
I think we can just make a subcommittee to actually look at that and then bring it back to the board. So what I'll do is I'll appoint you to that subcommittee.
Okay.
Put a group together, a couple of 2 or 3 of the, at least 3 members of the health board, and then you bring back the recommendations, and then we'll be able to vote on that then.
Okay, so that sounds good. I guess one question I would have is, will I have support from the health department to get some answers to questions?
You will have them.
Okay, thank you. So my last 2 points, I'm pretty sure the last 2 points. So you brought up the questions I had last time on the corporate council, and just to make, people that have asked me, I'll kind of summarize for them. So the corporate council reviewed it and basically agreed with the governor that what was passed into law is not enforceable and not constitutional. I then asked for follow-up, and Commissioner Nolden gratefully got those answers from the corporate council. Specifically, a couple things I asked about is if Public Act 87 of 2021 states that health departments can't receive funding from the Michigan Department of Health and Human Services or the state in general, the reply back, and I tend to understand this, is that the violation would not be on the health department, it would be on the state budget office. So understand, and I think that's a fair point, and as it was also mentioned, if someone wanted to pursue this, it would have to be, go through a court system. So for anyone's wondering, that's kind of the feedback that we received. So kind of wanted to address some of the things I heard in the public comments. I've looked quite a bit into government activities over the past 2 years. And one thing I'll say is school boards, although you're right, they're elected, I think they face the least political pressure in this county. And the reason is very simple. They have 6-year terms. 6. And that's like the longest elected term for almost anything in this state. Board of Commissioners only have 2-year terms. So they're probably under more political pressure all the time than any other entity, similar to legislatures. So although I understand what people may think that school boards are bowing to political pressure, I think they're the least likely entity to do so. And as everyone knows, it's very difficult to recall elected officials in the state of Michigan. So I don't think that's a concern either. So I understand why you might say that, but the facts are they're in there for a long time. In addition, I think some people had said it, the struggle I personally have had since I got involved in the beginning is my kids' personal suffering from whether it's masks or ostracization or whatever. And I feel like the other side that's screaming masks, screaming vaccines, they don't actually believe it. It's as if they think their position is the only thing that's important. And that's fine if people want to walk out. It only bolsters my point that they don't really care what I think or what we think. No problem, thank you. So in any event, kids are being harmed. Kids have wrote suicide notes. We've talked about this a lot. Suicide is a crisis now. Mental health is a crisis. The struggle I have, and this is where I appreciate why Dr. Hacker just kind of come, what I think, more to a balanced approach. There is harm from this. It maybe isn't a communicable disease, but it is harm. And people that just kind of scream that they care about unvaccinated kids and that they're going to get injured and all that, I just don't buy it because they don't care about the other things that go on. So I wanted to put that out there. And then the last thing I'd say to people, part of what I really struggle with too is the living in fear. We have all kinds of things in the world that can kill us. I mean, right now, odds of dying from COVID is 1 in 500, roughly. You have a 1 in 111 chance of dying from falling down, right? So should we stop walking, for example? 1 in 106 from a motor vehicle crash. I get why people are scared, because it sounds scary, this disease, you can't control it, and you have this idea you can control maybe your car, you can control how you walk. But the reality is it's not the most deadly thing to ever happen that we have to negatively impact so many people by forcing vaccinations, by forcing masking, by all those things. So with that, I'm finished.
Commissioner Norton?
Go ahead, Dr. Carvalho.
Yeah. Mr. Sherry, I would like to address a couple of things that you said. You know, a fundamental difference between the pandemic and getting run over by a car is that our behavior affects other people without their choice. So we regularly restrict people's freedom to not be able to drive drunk. Because, you know, not so much to protect the person who's driving, although certainly, you know, that is in the interest of the government. And, you know, that can be argued back and forth. But we do it because we don't want them to crash into somebody else and hurt them. And so to me, this is not equivalent when we're talking about that, because the problem is that somebody else's behavior is affecting me and people that I love and the other people around them. I think, so, you know, the other thing is that as a parent, I absolutely understand that parents know their kids better than anybody else, you know, but we are in an unprecedented time with so many changes. And so I think just from a critical thinking standpoint, to have somebody come in and say, in the midst of everything else, it's the mask that did this. It doesn't make a lot of sense to me. It may be true for some kids. I can't say it's not true, but I think for us to sit here
please, again. Now, if you're going to do that, you can leave. Dr. Carvalho.
Thank you. For us to sit here as a board and say, this is what it is, I think we have to be careful because it doesn't follow in a logical fashion that we can say that. And so I think it's very important for us to be precise in what we say and to listen. I've been listening carefully to every session that we have with comments and some of the commissioners' comments. I sat through the 2 hours of Board of Commissioners' comments. So I'm listening carefully, but there is a lot of you know, I think lack of critical thinking when it comes to people saying this happened and so therefore that. And I think that we just need to be careful about that when we make statements.
Thank you.
So I would just like to respond, and I appreciate that, and I don't disagree with you that you can conclusively say that, A plus B equals C in this case. And that's kind of my point, is mental health, and I'm sure you're aware of it, is not such a logical thing, and that's exactly my point. I think it's been asked by many people, has anyone here gone to the schools and sat with kids and talked? It's maybe not the mask, but it's the ostracization of the mask. It's the bullying. It's the inability to communicate. So I agree with you. Like, I can't prove it like a math equation, which I would do every day in my normal life. I can just tell you from talking to my kids and other kids, yeah, they're suffering because of it. And I don't want to blanketly say something as fact that's not fact. So I'm speaking from personal experience. And so I appreciate your comments, and I do agree with you that we can't just simply say it as if it's the truth. But if you go out there and talk to people, you'll start hearing things that you can conclude things knowing that, mental health is not a logical situation.
Okay, do we have any more for Mr. Shoemaker?
I wasn't going to, but I was kind of taken back. I hope we weren't equating the fact that people don't want to mask their kids and don't want to give their child or take a vaccine themselves to a drunk driver choosing to get behind the wheel of a car, because there's a lot of it. There's a big difference there, let's just put it that way. And I hope I don't think that's what Dr. Cordova was trying to allude to. Because what you're saying is we're as careless as a drunk driver because we don't want to put masks on our children, or we don't want to get a vaccine.
I wouldn't say.
No, I don't think she's saying that. I'm hoping she's not. And I'm assuming she's not, because in this world we forget, we've lost the ability to give somebody the benefit of the doubt. Okay, but statements were made. You could take that very easily, and that's what I'm getting to that point. And there's things here I see that Stuart will say, and somebody will get a look on their face, they'll take it that way. And I hope we don't get to that point. And I love that she's willing to have discourse and actually talk to us and tell her what she thinks. And that's what this forum of this meeting is for. I would ask us as board members and audience members to, though, remember, guess what? This is supposed to be a civil thing. Unfortunately, it's not on the street where we get to do what we want to do, and I'm guilty of it at times in my life. Guess what? Where I'm very passionate about things, and I will make a statement and out of order or what I shouldn't do, and we've got to remember that we're trying to keep this civil from there. I will say, whether you're upset with Dr. Hackert over the fact she's taken away the mask or not, or she put them on, I will say this, I will respect somebody that at least lives up to their word and says, this is the date, I'm gonna do something and do it, and whether you agree with it or not, and I disagree with the mask, but I will say this, she said she was gonna do something, and there's a word used for that in my household, it's called integrity. Whether you like what she did or not, guess what, that's here nor there, but she said, guess what, this is the date I'm gonna do this is the date she did. I would also like to give a thanks to Kaylee for answering my phone calls, whatever, and other than venting about the Steelers tying the Lions, I thank you all the time for answering my questions for the schools. Especially the superintendent of my children's school, really appreciate you getting back with me quickly or answering my calls. It means a lot to them because they can answer to their parents and get their questions answered. So I really do appreciate that. And I know it's been a difficult time for everybody. And I hope we will remember that, guess what, Commissioner Nolan and I have worked together for almost 3 years, and I will tell you, he and I have, if you've watched meetings, we have not been as nice to each other as I would always like to say at times. But in the end, we sit back there and we evaluate the situation. We remember that this should not change who we are as people, that we need to respect each other, we love each other. And I think he and I actually, between the dialogue, sometimes not positive or positive, have actually become closer because of it, because it's a reality. We're both trying to achieve something. We both think we know what's best in that situation and we care about it. And I hope we get back to that point of civil discourse. I realize when things are being taken away from you or not given to you, it feels that way. But I would encourage everybody to keep coming. Please do, even though the masks are off or if you want them on. But please be respectful from that point. And thank you.
Dr. Carvella?
Yeah. Thank you, Commissioner Shoemaker, for bringing that up. I certainly would not equate people who don't want to wear masks with drunk drivers. what I'm trying to say, I'll tell you that I have spent my entire medical career here in Flint. I came here in 1987 and have taken care of some of the sickest patients and those whose health behaviors have a serious impact on their health. And I have done it willingly and with compassion and even with some joy, trying to help take care of people. What's different, I think, is when, we have to understand that there are situations in health where what you do only affects you. And then there are situations where it affects other people as well. And there's always been a balance in public health between that tension between what you're doing is affecting other people and then personal freedom. And I think that's what we see on display here. But I just, again, back to precision of language, I want to make sure that we're not saying, well, you do you and I'll do me, and you don't want to wear a mask, you don't have to. I want to wear a mask, I'm going to, because the thing is that we are affecting each other. And so that's really the point I was trying to make. And thanks for the opportunity to clarify.
Okay. So now if we don't have any more questions, I want to make sure that the lady out there hears that. Do you have any more questions?
I just have one more thing.
Okay.
And earlier today in a board meeting, and one of our residents from the county, if someone could, I wanted to answer his City of Flint water questions he keeps bringing up. And you know who the gentleman I'm talking about?
I've been talking to Dr. Hackard. and we're working-
Okay, so
and we're
I just
working
want
on
to
that.
make sure he's getting
Yeah.
taken care of, and we're
Talking about
following
Woodson.
through. Yes,
Yeah,
I know, yes, I just want to make sure he's taken care of,
Yeah,
so thank you.
we're working on it.
Commissioner Nolan, thank you.
All right. All right, since we have nothing else, we are now adjourned.
So I'll sing you that.